Healthcare reform is, as you all know, under a lot of pressure at the moment, and we're not quite sure what's going to happen. I think it's going to be very hard to go backwards from where we are now, or at least I hope that's the case. Backwards doesn't look so good these days, unless you go back and hearken to the 1950s, which people like to sometimes do and talk about how wonderful healthcare was back then. But we also forget that there have been a lot of changes in the healthcare system that have improved things a lot since the 1950s. And the complications that we face going forward mean that substantial changes are going to have to be made. Even if you want to roll back health care reform, there's a lot of other stuff you would have to do. And I'm going to talk about that very much in the context of Medicare today, but can talk about some other health care reform issues as well. One of the things that I think you need to keep in mind when you think about health care is that markets don't work very well in health care. I'm a trained economist. I go up and down the aisles of the supermarket and think about prices and think about which items I want and whether a generic is good or not. But the market for healthcare is not the same as the market for tomatoes or Cheerios. It is a different kind of market that requires a lot more knowledge. It is a very complicated market. It is one in which few of us could afford on our own to pay for some of the things that we need when we need them unless we share those expenses. It is a market that is one that doesn't always respond to prices in the way that they should, in part because many Americans believe that more is better in healthcare, and sometimes that's the case. They also believe that the more expensive the better. That's sometimes the case, but not always in either instance. It's also very hard to get there from here. And by that I mean that there are winners and losers in healthcare reform. All of you probably know that because in many ways you all start out as relatively well off in terms of how the healthcare system is established for you with the federal employees benefit system. And many times people who are afraid that then their system is going to end up being worse while we're trying to make it better for others. And that is sometimes the case. But the winners and losers need to also recognize that over time, all of us are likely to be winners and losers in ways we can't understand. So what are the key problems that we have to make sure that health reform addresses in the future? First of all, 1 in every 6 people in the United States have no health insurance. That's an astonishing number for as wealthy a country as we are. And that has enormous consequences for all of us in terms of how health care is delivered in the United States. Just go to an emergency room in a large city and you will understand that issue very quickly. Or an emergency room in a small city. Just understand the number of lost hours of work from people who can't afford to get the health care they need and as a consequence get sicker over time. Just understand how much hospitals have to pay in many cases for people who are much sicker by the time they get to the hospital's door than they would have been if they had gotten care earlier because they had insurance. And another astonishing figure is that now 1 in every $6 of our economy goes to health care. That's also an astonishing figure. It's an astonishing figure, but in some ways it can be actually a reassuring one because we are not, I believe, going to be a country that's going to spend 1 in every $3 or 1 in every $2 on health care. We're simply not going to have a society that looks like that. So it means that we're getting close to a turning point where something has to happen. And the good news is, as a conservative economist, Herb Stein used to say, which I thought was a great comment and has been used by many people, if something can't happen, chances are it won't. And that means that despite all of the forces that are out there, despite all the incentives, despite all the things that look like they're heading us inexorably in that direction, it may not happen. Chances are it won't happen. We're simply not going to spend that much. So what will have to happen in between? One of the things that will happen is people will begin to say, no, I don't want that much health care. No, I don't want the most expensive piece of health care in all cases. I am going to think a little more carefully about what I get. I'm going to be a little more skeptical about things. I'm not going to take at face value the commercials that tell me that I desperately need medication when I'm not quite sure even what it is. I want to know what it is about Cialis, for example, that says it allows me to sit in a bathtub next to my husband holding his hand. I haven't quite figured that out. In the old days, it used to be the precursor to that one was dancing. They used to show couples dancing a lot. But I think people are beginning to be just a little bit more skeptical about that. Although we're not there yet, I still wake up on many mornings hearing on the news, in the morning on the news channel I listen to, about the David Drew Clinic, in which I always throw something at the radio and get up. Because the David Drew Clinic uses statistics to tell you how nobody dies when they go to the David Drew Clinic. And I think, how is that possible? Well, it's possible because they only treat healthy, worried, well people and who want full body scans. The rest of us who've got health care problems are dealing with the few health care problems we have and don't want to know about the rest of our bodies. But we are a nation that has traditionally loved health care, and we need to begin to think about whether or not new technology is always our friend. Sometimes it is, sometimes it's not, and that's something that I think all of us have to be in this together. We all have to talk about it. That's one of the reasons why increasingly a lot of my research and work is on trying to improve communication and information for individuals, because I think that's so essential. And it's essential because, as well, there's an astonishing amount of information out there. I can't tell you the number of articles that come out every year in medical journals. Your physician, whether he or she is the best possible physician in the world, cannot keep up with all of the information that's out there. We all have to have new tools to help us, and that means increasingly consumers have to take some responsibility for that as well. We have not invested in as yet, nor know enough about what constitutes quality care either in the United States. We do know that many people, as I said before, think that if it's expensive, it must be better. If that doctor charges more, he must be better. There's really no evidence of that. There is pretty good evidence, for example, that in many cases, hospitals that are the best are not the most expensive. They tend to be the ones that have done creative things, have been under a lot of pressure to be efficient, and therefore have found efficient ways to do things and to get people in and out. You don't want to stay in a hospital very long these days. They're dangerous places and you can get very sick. So we know that there are beginning to be pieces of information that tell us, but chances are when you go to the doctor and you undergo a treatment, it has never been studied or tested for its effectiveness. We do not know in all cases what works. We cross our fingers and hope, and in many cases it does, but we don't know if one thing works a little better than another. We don't know that very well, and we're beginning to make some inroads, but those are the kinds of things when people start to talk about them, and they say, well, maybe if something doesn't work, we shouldn't pay for it, then suddenly we're accused of rationing health care, talking about death panels, and doing all sorts of things that scare people because they think suddenly their protection, that is, to get anything they possibly need, is going to go away, rather than thinking about whether or not it's actually a good idea if someone finds that a particular treatment or test is not good for you and doesn't help, you shouldn't do it. In the old days, it was a little easier because when they didn't know what was wrong with you, they had to crack you open and check it out. And people were a little reluctant to have that happen. Today, they can kind of pop you into an MRI or a CAT scan, and it doesn't sound so bad, although over the weekend I was reading about the number of people who've been overly radiated by CAT scans and some of those problems. It's still the case that you don't want to do things that you don't necessarily need to do. So I think the message here about health reform is that wishful thinking to assume that all these problems will be solved by the market is just that. It's wishful thinking. And we should be very careful before rolling back the changes that have been made. I would not be the first person by any means to tell you that there should not be substantial changes in some of the legislation that was passed It was overly complicated. It included things that nobody really wanted because no one thought that was the piece of legislation that was going to pass. It made the senators happy, and it was something that even the senators thought was going to be fixed when it went to conference, and the House and the Senate bills got together, and things that people said, well, we put them in there but to make some people happy, but we know they'll come out, and conference didn't come out. But we are in a position right now where it's difficult to talk about fixing things because it looks like if you open that Pandora's box, it will all go away. And I think that that's not a good idea. We know from looking carefully at a lot of things that in the 1990s, for example, after the fears of Clinton healthcare that we would have managed care, and Clinton healthcare went away, but managed care came along, and there was pushback on it substantially. That was a period of time when actually costs slowed substantially and came down. But the number of uninsured didn't come down. The old saw that if you make healthcare less expensive, suddenly more people will get insurance and the problems of the uninsured will go away. It's just very hard to roll back prices enough for low income, moderate income, many of them working families, to be able to afford health insurance on their own. We also know that high costs do not necessarily reflect government regulations or intrusion. I'm on a national advisory board for the state of California, where the state of California actually does some very good things. One of the good things they do is they say whenever a mandate is being considered that would require that certain treatments or drugs or whatever be covered by insurers in that state, there has to be a series of studies, one on cost, one on the effectiveness of that, and one on the public health implications. And a few years ago, after the studies, they do a lot of these studies, someone came along and said, let's roll back all mandates and eliminate all mandates in the state of California and think how much money we'll save. Well, in their wisdom, the people that did this study, and I think they did it quite correctly, said, let's look at what is insurance that's not subject to the mandates, that is nationally covered insurance from large employers who aren't subject to state mandates, and see what it covers, and then say what is in the mandate that's not in those policies, and how much does that add to costs? Because if you eliminated mandates, chances are all those benefits would stay. You eliminate the mandate for maternity coverage, most insurance will continue to have maternity coverage. And so a lot of the mandates that are expensive are going to be covered anyway. When you did that, it was trivial, the amount of money that you would save by rolling back mandates to get rid of things that were really aimed at very small things and very small events didn't make any difference in terms of the average cost, a few pennies per month in terms of people's health insurance coverage. And when people say, let's let people go across state lines, that'll help competition. Let's buy insurance in Arizona if we live in New York City. Well, the Arizona insurance companies are not stupid. They know if you live in New York City, the costs of insurance are higher in New York City because the doctors and hospitals charge more in New York City. They also know that chances are if you're crossing state lines and you're looking for insurance, it's because you're not very healthy, because it's expensive wherever you are. And chances are then in Arizona, because they don't have as good insurance regulations as a lot of other places, aren't going to cover you anyway because you've got pre-existing conditions. It is the notion of pre-existing conditions and people being sick that really raises the cost of health care. And so, yes, some healthy people crossing state lines might be able to save a little bit. It's not going to do a lot.